What are the ongoing challenges for TRK inhibitors? One, I think the main challenge is really to help, how do we identify these patients? Because these patients do have incredible benefit from larotrectinib and other TRK inhibitors. So that remains a challenge, right? Because I would argue at this point, even in the United States, the vast majority of patients with metastatic cancer of some sort do not get tested with NGS or other standard platforms. I heard a statistic out there that lung cancer patients, only about 40% of patients actually get even tested for standard mutations such as EGFR or ALK-ROS. And so I think that remains a major challenge, right? How do we ensure that patients increasingly get this NGS testing? All patients at some point, or most patients at some point, will develop some type of resistance to any therapy, especially in the metastatic setting. To date, this drug has had incredible durability, and as I shared, median progression-free survival is 25.8 months. These patients remain on study for years, sometimes. The hope is that many of these patients will remain on study for years, but as we know from past experiences is that most patients who go on a small molecule inhibitor will eventually develop resistance. And our colleagues around the world, and Sloan Kettering and myself, are already developing the next generation of TRK inhibitors. There are other TRK inhibitors that have already emerged that target specifically mutations that may arise from resistant phenotypes such as solvent front mutations, gatekeeper mutations. And so that will be the next kind of generation of TRK inhibitors. I'm sure there will be other mechanisms of resistance that we discover as we learn more about this disease and about this pathway. And so, but I think what's hopeful and what's exciting is that the chemistry has gotten better, the biology has become more understood, right? And we are moving very quickly to implement with our colleagues at the FDA to get new drugs to our patients. So I think it's really a hopeful time in oncology.
I think what the experience of TRK inhibitors has taught us is that we really have to be ambitious in the targets that we go after. This was a target that I think just a couple years ago, or even when we set out to do this, would have been was considered by many kind of impractical. This is too rare. We're never going to find the patients. And I think what this shows us is if the biology is right and the drugs are right, we have the ability to have dramatic effects, albeit sometimes in small patient populations, but it's a worthwhile endeavor, and the regulators will get behind this effort and work with us to bring these highly effective therapies to patients. So I'm very excited about what the development of these agents means, not just for the patients that have TRK fusions, but for the broader oncology community, as well as the pediatric oncology community, which I think has really been shown that if you can identify even very rare populations of patients where safe drugs can be highly effective, that we ought to have the ambition to develop the drugs in those populations of patients.